Sir, how to acquire associates and when should we acquire?
You know what? There's a popular thing which Jack Ma says. Like initial of your career, you work under a good boss, so you
Hmm.
learn discipline.
Acha.
So coming to the dentistry perspective, I'll tell you in a dentistry perspective.
Hmm.
Initially, you work with a good organization, learn their discipline or whatever protocols is there.
Okay.
Second, go and start your own clinic. Third, distribute your work. Anyone who can do 30% of your work,
Uh-huh.
distribute it.
Acha.
That's where the associate starts.
Okay.
See, when the associate comes, half of your job is getting easy, like taking impressions,
Hmm.
recording x-rays, counseling, doing the paperwork, writing prescriptions, giving instructions. This all can be done with the associates. Then comes with the tier 1 and tier 2.
Okay.
Tier 1, obviously, you can get a lot of doctors who can associate with you. Then the question comes with tier 2. Sir, I don't get any dentist to work with me, so what can I do?
Okay.
You can try a graduate, a regular normal graduate like BCom, BA, or who are interested to come and work with you, not to do dentistry, at least to do the auxiliary services like doing counseling, taking x-rays, taking impressions.
Ji.
Because unfortunately, we don't have so many hygienists to accompany in India. That's why we need to take some graduate in the tier 2 cities and they do a very beautiful work.
Now we have talked about solo practice. What is consultation practice?
See, consultation, there's a lot of advantage with the consultation practice. Suppose nowadays, like 80% to 90% are girls. I'm not gender based talking, but if you take the scenario,
Haha.
see what happens once they graduate, if they're graduate or postgraduate.
Okay.
So they are uncertain till they get married whether they're going to settle in Hyderabad, so for example, in this town or a city, or they are going to shift with their better half. So, in that dilemma, instead of starting a clinic or instead of just staying alone, they can do a consultant practice. So, what the advantage? You have a flexible time. You will be working on your time. So, there's nothing you have to do a managerial skills, just like an employee with a part-time employee.
So basically, consultational practice is just like solo, but you are considering all of the consultants to come and do their work for you.
Yes. So that is a consultant practice. But there's little things which you need to consider when you are doing a consultant practice. Even in my clinic, there are some consultants who doesn't want to start their clinic, but they are happy with our clinic, and we are happy with them. They want to continue with like that.
Hmm.
See, there's a small attitude difference between a owner and an employee. A owner always thinks 10 steps ahead of what has to be done.
Yeah.
An employee says, मेरे को इतना ही काम दिया, इतना है तो बस हो गया. I impressed the boss and all. I always say the consultant should think like a practitioner, in the sense like a owner. See, what is the problem with for the consultation is if the more and more consultants or the new youngsters are coming, the clinics may stop your consultation. At the end of the practice, you may be jobless.
Right.
That is the only concern, right? So when you develop these skills and you think like an owner and you develop your soft skills, there are very small things like gestures like greeting the patient, explaining the treatment before you start, and just follow up with the clinic whether how what are this thing and the availability of time. If the patient suppose sometimes they have severe pain after you do a treatment, next day go back and just do a checkup, then you will have a very good consultant practice.
Okay. I think consultation practice is like good for the people who wants to move abroad in upcoming years or something, right?
Not only abroad, who wants to change places, that is one. And the second thing is some doesn't want to see, they are married to very rich family, but they don't want to because by heart they want to do dentistry passion, so they don't want to leave it. So to be in touch with that is one scenario which they consider as a consultant dentist. And third thing is some doesn't want to say like sit full time in the clinic, they have a family issues which they want to look after.
Okay.
This all scenario is a very good for the consultant practice. And nowadays, I see youngsters who do other businesses also, and they don't want to just sit in dental clinic waste time if there's no patients and all. For them also, it's a good scenario.
How about group practice?
Group practice, I say group practice is like what I mean is opening multiple clinics.
Acha.
That is one. And second thing is group practice, including associates.
So it is basically the extension of solo practice.
Extension of solo practice, but there's a little difference here. See, there's a new concept called as a group practice where you're a prosthodontist, I'm orthodontist, some is endodontist, and we start with 4 or 5 branches, and everybody is looking after in the main branch, and but going as a consultant to the other branches. So that way, it will become little easy for them to do a manageable skills, because initially you can't afford to put an HR department and you can't operations to monitor and everything. So that is one group practice. In India, it takes time, like where it started with nursing guys, where they form an association type of thing and they go for a duties.
Okay.
Like if somebody is feeling sick, then it will be replaced by somebody.
जी.
I think in future, even in dentists, like after doing BDS, they can form a group, and then suppose I'm going for a vacation for 15, 20
Hmm.
days and somebody has to look after my clinic. If I am a solo practitioner,
Right.
definitely they can go and do it. It's also there with anesthesia doctors, which they do. So that may be possible with the group practice. And when it's a multiple clinics, that also like one branch, it can be given a partnership. I'm talking about the solo practice, which is extension. There's a small difference. In a group practice means you are giving a partnership to the associate. There you are employing it and giving an incentive. But here you are giving a partnership in that branch so that they will have that ownership feeling.
I think in consultation practice and also in the group practice, even though a solo dentist doesn't want to like practice in upfront, he or she needs to know the work, because all of these consultants and group people will come. You need to know what are they doing. You need to know how good they are, because they are the one who is making your practice well. Now you are just a brand, but they are the people who is providing the service.
When we compare with tier 1,
जी.
tier 2, obviously you need to do major part of your work,
Hmm.
because initially you can't afford to call a consultant
Right.
and the patient won't wait because he's having pain there.
जी.
So you need to develop your dental skills, and you have to become and do all the treatments. 80% of the treatment you need to handle it, at least initial 5 years. When you come to tier 1 also, it's important. Why?
Hmm.
You should know the quality of the consultant which he is doing, whether he is becoming lazy, or you should know which, like, how can I serve this patient better than this?
How much you can trust on him.
Rely on a consultant, and as well
Hmm.
as when you want to do when you learn, there's an advantage. You can start implementing the new products and the new services. Like suppose now we got something called as air polisher.
जी.
Initially, I thought, wow, it's a scaling, right?
हाँ. I
Why
was
we
quite
have?
amazed when I came to your clinic. That was air polish. I
Yeah,
heard it for the first time.
yeah.
It was like ultrasonic के लिए थोड़ा सा लोग डरते थे. Air polishing is a new thing.
See, if we sit in the patient chair, we'll know.
Hmm.
When if you would have got your scaling done, you will experience
जा.
that scratching
बहुत
feeling
अलग
on the
होता है.
tooth
Right.
and this thing. Air polisher will remove the soft plaque and stains and
Hmm.
everything. And for me as an orthodontist, around the braces cleaning is a very
Ah,
difficult
okay.
task.
Right, right, right.
It's a soft plaque. It
Hmm.
works really well. I got shocked. There are a lot of patients who are opting only for air polishing more than ultrasound, though it is expensive.
Yeah, क्योंकि lot of people think that they
This
are
is
like
something like you are scratching on the
scratching
floor
on
with
the teeth and like
some
teeth are getting
digger or
damaged.
something
Yes.
like that. They feel the same thing. Even I get my scaling now, I feel the same. When money is not concerned to me, my experience is concerned.
Right.
Right? So the same experience we want to give it to the patient,
Hmm.
then you need to upgrade your treatments, new equipments and everything, and then you have to give a good experience to the patient.
Okay.
That is more important in tier 1, why you have to learn all
Experience.
the
Right.
treatment.
Now we have covered the group practice and consultation practice also. What is corporate practice?
First of all, the question comes, why I should go to corporate practice
Ah.
if you want to buy Rolls Royce?
Is it like that much? Like they are earning too much there?
Yeah, earning is a part is there. It's like, see, when you expand, you go pan India.
Hmm.
The most thing which we are lacking in dentistry is financial aspect.
Right.
I'll tell you why. From solo, we know how to go to group practice. But how you get the budget? Most of us think like we have to save it from solo practice and put it for this thing. No, you have to build up your profile
Ah, right.
on the paper. Then you have to start your MSME. Then how that's how you can grow into your group practice. From group practice, you need to go to corporate practice, because when you want to exit, you have to go for IPOs. IPOs in the sense you can go for a private limited company and do sell your shares.
Okay.
So for all this, the first thought should be what is our exit thing. Suppose I am a solo practitioner and my son is a dentist.
Hmm.
Obviously, there's no exit for me. I'll hand over it to my son. If it's a group practice, So we will be liquidating it, the shares through other partners. When it comes to private limited, there's a lot of opportunity because a lot of investors are seeing. Because when you see in a business sense, all the businesses, any businesses in the world will take it gives around 15 to 20% returns.
Okay.
You know how much dentistry gives?
How much, sir?
If you go as a solo practitioner, it goes till 50%.
What? 50%?
Yes. And if it is in group practice, it reduces to 30 to 40%. And if it is in corporate practice, go to 20%. It's as good as any other business, right?
No, my lot of relatives will ask me more discount now, sir. Thank you.
And you can encourage them to invest so that you can start your group practices.
People are not understanding that if you don't have a budget to run a clinic, you get some investor because the returns are so good. If you know how to practice it, like, and if you know how to market it, there is a good exit you can make.
You hit the point actually. That's why I believe we have to include these managerial skills in our graduation.
Ah,
See, all the other professions are doing it.
right.
When I was doing BDS, my brother is doing engineering. They never know how industry is or what is going to be practical.
Ji.
We used to go into the clinic, work on the patient. We know how to work on the patient.
Right.
Now it became reverse. We know how to work on the patient. We don't know other aspects, how to market ourselves, how to monetize ourselves. You see,
Ji.
now I am at the end of my practice. How to monetize my practice?
Right. Even after you, how does it
Yeah,
run?
even after me, how to run it.
Yeah.
Otherwise, also, if I want to shut it down or I want to sell it to someone, what are the guidelines? How to evaluate your clinic? If I don't know, how can I put my price to someone? So these are all important, which is neglected earlier. Now I think we should start. My sincere advice to youngsters is when you start your internship, okay, relax 1 2 months. After that, you start, go to some clinic, learn managerial skills, learn what people are doing it. That thing already you know, you are a handful of dental skills. Now you learn the managerial skills so you can market yourself, you can become popular, you can be more profitable. End of the day, you can buy in Rolls Royce.
Okay.
One more reason for going for a corporate practice is when you want to create employment, when you want to uplift your youngsters or the profession which you want to do it, that is one of the cause where you want to go for a corporate practice.
Okay. Sir, do you know any examples that are corporate practices and run by dentists? Like yours is one, Dr. Smiles.
Ours is, we can say, is in a transition phase from a group practice to corporate, which we are not doing. And you would have heard about Siri Dental Hospital, which they have 7 branches. Dr. Srinivas, he has 7 practices in Hyderabad. That is also transiting to corporate practice. Pada Dental, which are existing in 4 states.
Oh, amazing.
Andhra Pradesh, Telangana, Karnataka, and Tamil Nadu. Now they are. Clo Dental, is in pan India.
Okay, Club Dental is run by a dentist?
I don't think it's run earlier. Like Shekhar Chinnupati is the who is to run under the brand of Dentis.
Okay.
He is the first person. He is our inspiration for all of us to how to monetize the clinic, how to grow, and then it is merged with Clo Dental, and that is I don't think Clo Dental who is heading is a dentist.
I know how you treat your employees. You have that 1 year policy system. Like, do you want to enlighten on that?
When you say about associates, see
Uh-huh.
what happens is I feel a dentist should have 2 things. One is dental skills. He should be good at dental skills. Second thing is the attitude to become a owner.
Hmm.
That's what I was mentioning. Little ownership, so attitude to become a owner. And third thing is to able to manage it.
Okay.
So in our clinic, what we offer our employees or youngsters who join to us is 1 year you work with us as an employee.
Okay.
Okay, we pay you good salary.
Hmm.
After that, if you are interested, our frequency matches, you see our vision, and you feel it's a promising clinic, then we'll offer a partnership to him into the new branch or in the existing one.
Amazing. So, do you see any change in attitude?
There's a lot of change in the attitude. When there's an employee, they, as I said, they will only, whatever the work is assigned, they will do till that time and they will relax. When it comes to the incentive part,
Ji.
other means not only ownership, intensive part, they'll be concentrating on the treatments. How okay, how to convince means put little more effort to make him understand that this is also important, which you are neglecting.
Hmm.
That is the second point when the incentive. And third, when it comes to owner, they will also have the managerial skills. they'll acquire it automatically.
In the next podcast, we will look after the finances and so how to decide what should be the price of what treatment in your city. For this podcast, thank you so much for sharing your 25 years of experience. It has been a very valuable lesson. It has been a very valuable podcast.
Thank you, Prathamesh, and see you in the next podcast. I think that is more brainstorming, talking about financial, which all of our dentists will be not very happy to listen to the financial aspects, but definitely we'll make it simplified and then we'll go through the financial.